Behind the Mask, the podcast. Behind the Mask. Behind the Mask. With Dr. William, the OG genius. Behind the Mask, Dr. William. The more you know, the better you do. Okay. Behind the Mask, the podcast.
I still love that song just as much.
Oh, it's a great song.
Welcome to season 2 of Behind the
Yes,
Mask.
can you believe we made it?
I'm Gabby Allen here with the OG genius, Dr. William, board certified plastic surgeon. And we have a very special guest joining us today, Cindy Wolfhaver, visiting from North Carolina,
Yes.
a specialized massage therapist.
Yes.
And we're going to talk about the lymphatic system today and more massages. We're going to get deeper into our post-operative care today. So let's start with the basics because we've talked about it a few times and I don't remember. So let's talk about lymphatic system 101. What do we need to know?
Okay.
Let me interrupt you, Gabby.
Sure.
I want to also introduce Cindy as well.
Yeah, please do.
Because Cindy and I worked together for, I think it was 9 years.
Yeah.
In North Carolina when I was practicing there. When I finished up at Duke, then I stayed in North Carolina. And I worked in the hospital as a level 1 trauma center. And Cindy worked in the wound care center, and she still does, and with just an absolutely fabulous team and a group of people. And we spent a lot of time, and we treated a lot of people with totally different things, wounds and trauma to lower extremities. And it was a different part of my practice, the reconstructive part of my practice, which I no longer do. But it was really a time, and we've been reminiscing how much fun it was, and it was great. So I invited Cindy to come down to Miami because she's an expert and is registered. What do you say? Registered, certified,
Certified lymphadema therapist.
Yeah.
Yes.
So I'll just give you a little background as to why I invited Cindy here and why she what we're going to talk about. And because I think a lot of people really don't know or understand the lymphatic system. I always think that the lymphatic therapists are kind of like unsung heroes. Nobody really knows about them.
Yes.
They do these things and nobody really understands what they do. And there's not many of you.
Yeah.
And so I wanted to shed a little bit of light on that and then to Gabby's point, get in and talk about the lymphatic system and what it is. And for us, how it relates to plastic surgery and specifically liposuction or patients having BBLs, and how they can improve their results by actually taking care of the lymphatic system. For me, and I mentioned to you this before we started on the air here, that you had a pretty significant impact on me, and I don't think you knew because I probably didn't tell you, but you don't always realize these things when you go through training. It's sort of only in retrospect that you sometimes start putting all the pieces of the puzzle. At least for me, I always think that I arrive at the correct destination, but I always take a longer route to get there. And so that's kind of what happened with the lymphatic system for me. Obviously, I knew the lymphatic system in medical school. The trouble, the problem with the lymphatic system?
Yeah. A lot of it is invisible.
Exactly.
Yes, I know that.
It's very nebulous.
Yes.
So
You know a few structures. That's it.
Yeah.
Yeah.
I think that's why there's such a knowledge gap, is that you can see an artery, you can see a vein, you can see a tendon, you see a muscle, you see a nerve, but the lymphatic system is essentially invisible.
It's invisible to you.
Yes.
Because the minute you take some skin back, you've destroyed it.
Right.
Yeah.
Yeah. So
You've
never
destroyed that area.
technically
Not the whole
see
thing.
it. Yeah.
But you can't see it.
No.
You can see the thoracic duct.
Yes.
You can see lymph nodes.
Yeah.
The rest of it is kind of, you're blind to it.
Yeah.
Yeah.
So I do think that's why it is kind of mysterious and unknown.
Yeah.
But let me tell you, the thing that you taught me, and that was very impactful in terms of my understanding of the lymphatic system, and in terms of my understanding of what somebody who actually knows what the lymphatic system is and does and how to treat it, and the power that you people have, is really something. And so what I used to do a lot of lower extremity reconstruction, obviously,
Oh, yeah.
So let's say somebody was riding their motorcycle and broke their leg, and usually with that comes a lot of damage to the soft tissue, the overlying skin and things. So the orthopedic surgeon, usually Tim Harris, would fix the bone, and then they're kind of like, all right, your job now, you have to fix the stuff on the outside because they can't be walking around with an exposed bone. And the lower extremity is difficult because it's hard from a reconstructive point of view because there's not a lot of tissue around, but it's also difficult because it's so dependent and it's way below the heart. And so I had a patient who the surgery was successful. I mean, the flap worked and everything was there, but he just wasn't really healing very well. And Cindy came to me, and she's very humble, and she's not one to kind of barge in the room and knock the door down and tell you what to do. And so she said, like, why don't you let me just work with him? And I really was kind of like, I needed help anyway, so why would I?
Why not?
Yeah. I mean, all right, let's have this lady do whatever she's going to do. I don't really know what she's going to do. And I was blown away because what Cindy did was get all of the fluid out of this man's leg. And once she did that, the healing was just like night and day. It just turned the corner and healed. And I realized, wow, I did the surgery. I'm the surgeon. I'm supposed to fix him. I'm supposed to do this. But I really wouldn't have been able to do it unless Cindy did what she did. Mm-hmm. And that really exposed me for the first time to the power of what actually manual lymphatic drainage can do.
Right.
And I want to be very clear because this is not a regular massage. This is a treatment modality by people that are instructed and trained and have practiced and really understand the lymphatic system, and they can manipulate it to the point where it's therapeutic and it helps people heal. So, I'm a huge proponent now. I was telling you recently, someone who's very close to me who lives in my house had a facelift in this year, and she had a lot of swelling in her neck. And I came home one day, and her neck was completely different. Her face looked totally different. And I was like, what in the world did you do? And her surgeon, who's older than me, very respected, super smart, excellent, and experienced, and he's like, I need to get some manual lymphatic drainage on this patient. And the result was absolutely just mind-blowing.
Yeah.
And I've seen it over and over and over and over, where once you treat the fluid in the lymphatic system properly, the results are absolutely just mind-blowing, just amazing. Yep. So before we get in, this is a long preamble, before we get into the lymphatic system, the reason I really want to talk to you about this is because the lymphatic system is important, not just for lower extremity reconstruction and these types of things. As you know, it's effective all over the body, and it plays a very pivotal role in liposuction, in the recovery from liposuction. And I think there's a lack of information of really how to recover properly from liposuction, and that's one of the kind of main points of this company that I started a couple of years ago called OG Recovery, where we're trying to educate patients as to how to recover to get the very best results. We always say better recovery, better results, because if there's no real proper recovery protocol or information or education, then I find that the gaps are filled with people that are loud and they're not knowledgeable, and there's a lot of misinformation there. Right. So that's kind of what I see my role here is to try to clarify everything and explain to patients who are going through liposuction how they can get their very best skin afterwards. And I think the manual lymphatic drainage is a very key component of that.
Right.
So
Yeah.
that's the reason I have you here.
That's why I'm here.
And so I really want to use your knowledge to do that. So I'm gonna let you speak.
Okay. Okay.
And just tell us from a very basic point of view, for people that don't understand what the lymphatic system is, just what it is, what it does, what's the purpose of it, and then we'll get into how you treat it and things.
Sure. Okay. Well, first of all, I'm going to correct it a little bit. I'm a certified lymphadema therapist, but my license is in physical therapy.
Right. Yes.
So CLTs, certified lymphedema therapists, are usually licensed in another arena. PT, OT, RN, usually not a massage therapist, but
Right.
there are some,
There are some, yeah.
massage therapists. I don't know if they are allowed to say it's MLD, manual lymph drainage, but in any case, there are specialties within my licensed
Yeah.
specialty. Anyway,
But not everyone that goes through. So
no, right.
and I remember I was very surprised when I came to work at the wound care center,
Yeah.
and it was filled with PTs.
Yes.
I'm like, what the hell are all these physical therapists
Yes.
doing here?
Yeah.
And you're like, yeah, you didn't realize that PTs do wound care? And I'm like, no, I did not.
I didn't know either before I started.
That's what you guys told me. You're like,
Yes.
yeah. So the wound care is a branch of
Of physical therapy.
physical therapy.
Exactly.
But not everybody that becomes a wound care specialist does the lymphatic
Correct.
therapy.
Correct.
So that was additional training.
Exactly. It's a like 130-hour course that they cram into 13 days. And you're getting lectures and you're getting practice on MLD and practice on wrapping, lots of tests. So it's pretty grueling,
Intensive, yeah.
intensive, and thankfully my hospital system paid for me. Otherwise, it's also very expensive to get that training. And surprisingly, the company that trained me is actually in Florida.
Oh, okay.
Yeah, ACOLS.
Okay.
I'll give them a little shout out.
Yeah.
So anyway, starting with what the lymphatic system is.
Yeah.
It is not part of your blood circulation. It's a one-way system. So instead of the arteries and the veins just circulating, this is a one-way system trying to get to the veins so that it can be eliminated. Because the lymph fluid is really trash. It's the garbage. It's the trash from metabolism that builds up every day, all day long, underneath your skin. Normal, healthy people, it moves to the lymphatic nodes to be filtered out on its own as you're moving around. It works really great at night when you're laying flat and your legs are not fighting gravity anymore. Your arms are not fighting gravity anymore. It can really do its job. Unfortunately, it doesn't do its job laying down when you have face.
Yeah.
Yeah, it gets worse when you lay down, when you have lymph fluid in your face. And it gets better when you stand up because the gravity is actually helping you because the lymph nodes are lower.
Right.
So anyway.
The lymph nodes are all the one. So let's talk about where the lymph nodes
Okay.
are. And I think people are familiar with having a sore throat or cold, right? You get some.
Sure. Yep.
I remember my kids coming to me, Daddy, what is this lump here,
Yeah, and it's and
I'd
kids,
always tell them, like, you have a day to live or something,
kids get that swelling pretty regularly,
Right.
especially with colds and things like
Yeah.
that. Adults don't get it as much. If you feel it, there's probably something a little
Yeah.
more
a little
involved.
bit more worried,
Yeah, a little bit more involved. But all of your skin has lymphatic collectors that are draining to regional lymph nodes. So this half of your body and your back and your arm are going to lymph nodes up underneath your arm. Same on this
In
side.
your armpit.
In your armpit. In your head, you actually have some that surround your ear. And then you also have some in here. And then there are some in the back of the head, too. So head MLD is fantastic for migraines and things like that because it really does help just kind of relax you and get rid of some of that. For the legs, it comes up, so it has to travel north.
Yes.
Which is really difficult, like you were saying.
Yeah.
You're fighting gravity. What helps with the lymphatic system when you're walking around, the muscle pump action actually helps to move that fluid up.
So as you're contracting your calf muscle,
Yes.
that's kind of squeezing and milking the fluid
Exactly.
north, as you say, going up back towards the heart.
And it's actually going toward the lymph nodes that are in the groin.
In the groin, yeah.
Yeah. Once it gets into those lymph nodes, and I kind of want to give this part of the anatomy because it's a really important part. Once it gets into those lymph nodes, it then goes deep inside the pelvis into two little tubules that come up and join together right about here. And then it comes up through your chest in a duct called the thoracic duct. Some people call it the cisterna chyli. It's a cistern of garbage. And then it splits and dumps into the subclavian veins right here. Once it gets there, that garbage is now part of your blood circulation, and it's going to get carried to your kidneys, and you're going to eliminate it. But until it gets there, it's not part of your blood circulation. So it's just this swamp in your system. One of the things that I tell all of my patients to do that have this kind of swelling in their legs is it's an exercise, and it's so easy, and everybody can do it. And everybody should after some kind of surgery or any kind of swelling. But this thoracic duct actually pokes through the diaphragm. The diaphragm is a big dome-shaped muscle that goes from side to side and front to back right up underneath your rib cage. And it flattens out when you take a deep breath in.
Right.
And then when you exhale, it lifts back up again. Well, if you have this rubbery vessel poking through a really hard muscle, this is milking that vessel
Fluid.
empty, and it's sending it up to where it needs to be. Because like I said, this is a one-way system. It's not going to push it back down. It's going to help lift it back up to where it needs to go so you can eliminate it. Okay? So I tell all my patients, if you're recovering and you're laying down on the couch and you're watching TV, every time there's a commercial, do 10 deep breaths. And what I mean is the deep diaphragmatic breathing, not, where you're lifting your shoulders up, but where you're actually expanding that diaphragm, you're dropping it down. And I tell people, hold on right here, take deep breaths, and then blow it out and just keep doing those. It's not going to hurt anybody. And it really helps. If you empty that thoracic duct, it's like a straw effect. It's going to start pulling that fluid from down below. So it can help everybody.
Yeah, and I've seen that before, and talked to therapists before about that.
Right.
And everyone says the same thing. Doesn't do any harm.
Right.
Seems like it's totally useless, not doing anything.
Yeah.
But it's actually very effectual.
It's
I
very
don't know if that's a word, but it's very effective.
effective. Yeah.
Yeah.
It
Very
is. It's
effective.
very effective. And when I've had like injuries in my feet, I will do MLD on myself, but I will start with that just to clear everything out. And then I start moving the fluid, and I can actually feel it. Now, I'm a healthy person. A lot of my people have very fibrotic lower extremities. They're not going to feel it right away. And in fact, they probably have so much mess up here that we have to clear out before we can even start moving it from the legs. But it is a good start, is clearing
So you
out.
start by the deep breathing.
Deep breathing.
And then that sort of opens up that
opens up
thoracic
that
duct.
channel. And we also start with
That's the main highway. kind
That's
of
the
thing. You're
main
cleaning
highway.
out the main highway.
exactly. We've got to get the cars out of that part of the highway before these guys can come.
Get on.
Yep. And then we do a lot of, because deep breathing is also kind of relaxing.
Yes.
We also do a little bit of relaxing, just, light touch to help relax. We keep the lights down. We have maybe some soft music playing, because relaxing really helps the lymphatic system. It's running on the parasympathetic nervous system, and we don't want you in fight or flight. If you're like this, the lymphatic system shuts down and says, I can't be important right now. Everything else is more important than I am. And that's why it works really well at night too. Aside from the fact that you're laying down, you're also totally relaxed and it gets to do its job without you getting in the way with your head.
So let's say, so what are you doing? The lymphatics are mostly skin-based, except the ones that you're talking about that are
Exactly.
these big,
Exactly.
deep highways. So take me through kind of the process as to what you're doing in the skin. How do you perform this?
Okay.
And can
so
you perform it yourself? And
you can, but they have done studies where it's really not as effective as an MLD
you,
therapist.
yeah.
Yeah, because of the relaxation. You're so involved in trying to move it, your brain is in the wrong spot.
yeah,
You know, if there's a way that you can relax and do it. Now, like I said, I'm able to move the fluid out of my leg if I have a swollen ankle or something. But I understand that I need to get in a relaxed space before I can actually be effective. So in the skin, the thing that the doctors don't see because they ripped the skin back and they actually destroyed the collectors is a bunch of collectors that picture fishnet stockings all up right up underneath your skin. And they're
That's
all
the network of
that's
the
the
lymphatic
network of the
vessels.
lymphatic vessels.
those invisible.
The invisible things you can't see, but they are going in the direction of, it's like I said, it's all flowing toward a lymph node. It starts in an end vessel that instead of it being an open hole, it has scales along the edges. And when I stretch the skin, it opens up those scales so that the fluid can flow in. If I press really hard, I'm doing more damage. So when you were talking about how this is so different than massage,
Yes.
massage is actually the Swedish term for deep kneading. We're not deep kneading.
Right.
We do that a little bit when we're doing fibrotic techniques on really hard fibrosis, but otherwise we're staying skin level and we're stretching the skin and then turning our hand to send it the right direction. So not only stretching, but turning. And you can kind of see that I'm stretching and turning and I'm not going much deeper than the skin right there. It's kind of hard on somebody who's really, really fibrotic, but
Those kind of woody.
the woody fibrosis. But as you do more, and it takes the intensive training or the intensive phase
Therapy.
of the therapy is like 5 days a week for 2 to 3 weeks, because you're trying to clear some of that junk out before you can actually get to fibrotic techniques and things like that. The point of the therapy, though, is for the patient to be able to do this on their own. And so they are sent home with exercises on self-MLD, very good skincare, because if it's fibrotic, the good blood flow, the arterial flow that will attack any bacteria that's sitting on the skin, it's so far away from the skin because of that fibrosis that they're very, very compromised and prone to infections. Yeah. But that's not your patients. Your patients are more healthy.
Yeah,
And I know that because you do a lot of really good screening. You are truly, speaking of things that I've learned, is you've got to have the right capacity to heal.
Yes.
And if your chemicals in your body are all messed up or you're malnourished, and I'm not meaning very, very heavy people can be very malnourished.
Yeah.
It's because they're not getting the right nourishment. And you need that to be able to heal. And I know that you check people's blood work before you
Yes, of course.
venture, and you try and optimize them.
Yeah, you have to.
Yeah. Yeah.
So something that you mentioned that was interesting to me, and I know you don't come at it from the cosmetic point of view.
Yeah. No.
But it's all is applicable.
It's all the same, though.
Yeah,
Yeah.
it's all the same because it's the same system.
Yeah.
But one of the things that we do for post-operative recovery is patients will use, everyone wears a faja.
Uh-huh.
And then we have foams and we have boards. Okay. And the boards are very firm, and the patients will wear it in the front.
Okay.
And they wear it in the back in the sacral area. and that is very heavy compression for really seroma prevention.
Yes. Yeah.
And then they wear the foams in the post liposuction foams in the other areas around the body.
Okay.
And the foams have a few purposes. You know, they've been shown to decrease bruising, swelling. I think there's a strong effect that they have to prevent fibrosis. And they're working on the lymphatic system, right?
Mm-hmm.
So,
Yeah.
but one of the things that I see is patients they want to use the boards for a very long time because they think that having something hard and firm is going to compress and going to make them flatter. Mm-hmm. But because you alluded to this just a minute ago, where if you have it, so from my point of view, I like people to wear boards for 2 weeks to prevent the seromas.
Uh-huh.
I like them to wear the foams for 2 weeks, but then I don't want any more of that heavy compression.
Right.
Because when you're and correct me if I'm wrong, but when you're applying that hard board to that area that's just it's post-surgical,
Yeah.
you're compressing all of that. It's
Yeah.
really the opposite of the lymphatic
Correct.
therapy, right?
Exactly.
So
exactly.
I know that you probably wouldn't like any boards at all, but
I like the idea
we
that
need them from a seroma point of view.
and I like the idea that they would help with seromas because your liposuction created a cavity and
Right.
it's got to readhere.
Right.
And so I completely understand why you would use that. But I also agree that you got to get them off at
You
some
got to
point.
get them off.
Yeah.
And that's
But I like
the
it that-
2-week mark for me.
Yeah,
And
but I like it that you use it in conjunction with the foams because the foams are channeling some of that lymphatic fluid.
Right.
Because I would imagine they're ribbed
Yes,
like that.
yes.
Yeah. So that's channeling the lymphatic fluid. It's helping to channel it, and with the extra compression on, it actually is helping to move.
yeah,
that.
there's it's like a little mini manual lymphatic drainage.
Exactly.
With the body's own micro movements, even just with respiration.
And there you go. I mean,
Yeah.
that's where the deep breathing would really
Yeah.
help because not only are you moving the fluid out of the thoracic duct, but you're moving the fluid that's right up underneath the skin that the boards and the foams are addressing.
And that's interesting. I don't really talk about the deep breathing, but I think that should be part of our protocol.
Yes,
to do that to
Again,
help.
you're not doing any harm.
Yeah, there's no
and
harm.
it really helps with the relaxation. The other thing that the foams are helping with is moving that bruising. Like you said, it really will help with bruising because the lymphatic system picks up bruising.
So let's go into that more detail because that's great. I love you brought that up.
Yes.
And so, what is a bruise?
Well, a bruise is all that heme, it's blood.
Yeah.
It's the and it's trash at that point because it's outside of the circulatory system. Just
Right.
like I said, it's not in the vein anymore. And the lymphatic system is going to pick up that trash because these molecules that are there are much too big to get back into the vein. The vein has little tiny pores where that collector, that end collector, those scales open up and can take all those big molecules in.
That's interesting.
Yeah.
I never understood that.
Yeah,
That
so
makes total sense now.
Lymphatic fluid is protein rich, and the protein is a really long chain molecule, and it
Yeah,
can't
they're bigger.
it can't get into the veins. So the lymphatic system has to pick it up.
So that's really sort of the science behind decreased bruising and getting rid of bruising after lipo with the foams.
Yeah, I like that you have the foam with the board because then just even doing the deep breathing will help the body do that. But I also like that you get rid of it after 2 weeks and go
because-
into something like that because the targeted compression that you have with that faja, it's amazing.
Yeah.
I'm blown away by that.
Yeah, so it's a
I
really
want
good
10.
It's a really good garment.
Yeah.
And so and then help me understand then what, because we're so interested in this sort of recovery protocol concept and trying to do things the right way to decrease fibrosis is everything in when we talk about liposuction or, BBL is lipo, we want patients to have the very best skin so that people can't tell that you have lipo. The
Right.
problem with lipo is you can have some telltale signs
Yeah.
in your skin afterwards, and part of it is based on the quality of how the liposuction is performed.
Right.
But then a huge component is on recovery.
Right.
And so that's why we want to do whatever we possibly can during that recovery phase, which is, lasts a year.
A year. Exactly.
And people really don't understand how long it takes
Yeah.
things to heal.
Yeah.
So we're doing the compression and with the boards, and then at 2 weeks I'm like, stop doing the compression with the boards.
Right.
It's very difficult. People just want to keep those on, and it feels good, to be kind
Yeah.
of tucked in there.
Yeah.
But that's when I want them to come out of the boards.
Right.
And then the way I look at it, you said that there's that vacuum, right?
Yes,
We created
that
that
cavity.
space, that cavity, and then the compression and just your body's natural healing is going to shrink that. That fluid, because when you have liposuction, you're going to be draining for a couple of days.
Oh, sure.
And that fluid that comes out, but that's different fluid
Yeah.
than what we're talking about, right?
Right.
So-
that's coming from that space. It's not coming
Right.
from the skin.
Right.
Yeah.
So that's why I think the compression is good to help close those gaps and everything. But once that's done, stop the compression. That not with a faja, but with these heavy boards, and then get into the manual lymphatic
Right. Exactly.
drainage.
And so, I was saying that it's not as effective to do it yourself, but I will say that a lot of people who go through surgeries or have a wound or whatever, they don't want to own it. They don't want to touch it. And if you've done this much for yourself, then continue for that year of trying to touch the areas that were affected, love on it, get that fluid to move, because like you said, 2 weeks, sure, that'll prevent some seromas, but I'm sure that some of that fluid is still in that cavity. The cavities aren't completely
Right.
adhered. It's going to take a long time.
Yeah.
And if I can't touch anything, I
Yeah.
need external help, I need somebody else doing it. No. If you've gone this far to do this for yourself, then you've got to love on your own body. You've got to move this. Even if you're just doing some sweeps in the shower up into your axillary lymph nodes, if you're moving the fluid down into the inguinal lymph nodes, just sweeps, just things that will help move that and get that back in place where it's supposed to be.
Well, so you bring up a really good point, and this used to come up a lot, obviously, when we work together and do all this. And it's natural, it's human nature. Like if you cut your finger, maybe you carry your keys in your left pocket instead of your right pocket, so you have to put your finger in there. You go to say hello to somebody, you're like, hey, sorry, thing, and you really ignore it.
Yeah.
And it's the opposite of what
Yes.
you actually should do.
Exactly.
And you should no, you're not going to go and start heavily massaging a fresh laceration or something.
Right.
But you should touch it.
You should.
I mean, we
You
had
should.
a lot of
And you
those
should look
cases
at it.
where
I mean, I had, God bless him, a guy who lost his thumb.
yeah,
He healed faster than anybody I've seen because he looked at it.
Yeah.
He touched it.
Yeah.
It's his.
Right.
It's not some caregiver's.
Right.
It's yours.
Right.
Hang on to that.
yeah,
Yeah.
and then perform the touch,
Yes.
which is different than the therapy in some ways.
In some ways it is,
Yeah.
but it's okay if you're not perfect at your little half circle. If you're just
Something is better
something
than nothing.
is better than nothing.
Yeah.
And as long as you're relaxing and in the right position, of course, I'm a big elevate your legs kind of
Yeah.
person. So, yeah, you've got to help yourself as much as you can.
So our protocol, patients will get sort of regular massages to begin with,
Mm-hmm.
and then
Massage, deep
yeah,
kneading.
yeah.
Okay.
Well, some form of
Some
that. There's a
okay.
lot. I don't think any of that is standardized,
And I
think it
don't
sort of
think that
depends
that's
where you go.
right, but I don't think that that's against any of the. Again, you've got healthier people doing this. They
Yeah.
don't have a blown out lymphatic system
Right.
already.
Right.
So you're at that point, I think right after you're more concerned about that seroma forming or
Right.
that you've got to get that cavity closed down.
Closed, right.
Yeah.
And then I do think it's very important then at that point to start MLD if you can
Yes.
find somebody.
Yes.
And it has to be somebody who really is skilled at doing that.
Yes.
And so you should be able to tell if Gabby has surgery and she comes to me for a massage and I'm just doing the deep
Yes.
tissue massage. She should be like, oh, well, this is not MLD. She comes to you,
Yeah.
and you're doing a totally different technique that you,
Right.
I mean, as a patient, you can tell
Right.
if somebody's
Exactly.
doing actual MLD or not. Now,
Right.
whether they're good or not, you don't know. But I mean, at least you can tell the difference between somebody using like a hardwood roller,
Yes.
or
exactly.
somebody who's doing
Right.
doing like a
the,
light touch.
The light touch in the right direction.
Yeah.
You're not ever going back down.
Yeah,
You're
everything
always
is going
toward the
towards
core.
the lymph
Yeah.
nodes.
Yep.
And I had mentioned to you a roller, and that to me, so the way I tell people to use the roller is at the beginning to use it sort of like the massage, but then to use the vibration and very light touch
Yes.
to mimic doing the manual lymphatic drainage.
Right.
And so we're always talking the abdomen and the sides
Of
and the
course.
back from
Yeah.
the lipo.
Yeah.
So take me through then, you don't have to demonstrate it, but show us what the direction and the correct way to kind of how we move in that fluid. I always
Sure.
tell patients the lymph nodes in your inguinal region, in your groins, are kind of like, I picture them like big drains, like a
Yes.
street drain where
Sure.
all the fluid is just, trash or
Right.
the stuff is just going down those drains.
Right.
But not everything goes that way, right?
Right,
So
exactly.
tell us your
Okay.
expertise. How would you be using the roller in the direction
Sure.
to move things correctly?
Again, it would kind of, I guess, depend on where your incisions are, because I would be a little, I would go up to the incision, but not, I guess.
Usually
over
they're
it too
closed.
much. They're
Usually they're
closed?
kind of
Oh, okay.
healed over at that
Okay,
point.
at that point. Oh, yeah, that's right, because
Yeah.
this is after your 2 weeks.
Yeah.
Yeah, so you have, I showed you how you've got these regional lymph nodes.
Right.
Well, right about in here is a no man's land. It's like the skin lower is going to your inguinal lymph nodes,
Mm-hmm.
but the skin above it is going to your axillary lymph nodes. You can reroute it.
Oh, you can?
Yes, you can open that up by starting there. I mean, do your deep breathing, maybe also do a little bit of massage right in here. Again, it's not going to hurt anything, but remember I told you that that's where the inguinal lymph nodes eventually dump all their fluid in,
Right.
is right here. So if you open that up, and I do the crossover, it's harder to do it if you're here, but you're doing just kind of it's not a digging motion, but it can look like that. It's very light though. And that opens up here so that then when you start rerouting, you have more place for it to go.
Okay. That makes sense. Yeah.
So, and the rerouting is just, like I said, a simple, if you want it to go to these lymph nodes, if you want to stay away from here because there's some incision or some pain or something
You can
there, then you
reroute the
can
fluid.
reroute it by sending it that direction. But you have to touch your skin over the top of that watershed. Otherwise, they're going to stay separate. Okay? So if you're using a roller, you could just lightly do it up the side like that. Or if you want to stay away from this part, you can send it that way.
Move it down.
But whichever way you're doing, I wouldn't
Go back
confuse
and
it.
forth.
Exactly. Because then it's just going, where am I supposed to go?
It's one way direction.
One
so
way.
When you're going to be using the roller, you're going to be moving it in that direction. Whether you're going to
Exactly.
be going down
Yes.
to the inguinal lymph nodes,
Yes.
or you're moving that fluid up.
Up.
Now, would you recommend that? So, if you're halfway in this watershed area, would you, let's say you're not concerned about any incisions or anything.
Right.
Would you kind of move the bottom half down and the top half up? Is that
Yeah.
how it normally flows?
Yes.
Yeah.
That's exactly how it normally flows. And, you know, usually as a lymphedema therapist, we're looking at one extremity because it is usually a very unilateral problem
Right.
for a patient. So somebody who's had breast cancer and had a breast removed, they usually had some lymph nodes removed. And that blocked all of the fluid for this arm to drain to.
Right.
So what we do is we try to redirect this way and down. We're trying to get that fluid in a different path.
Yeah.
It's not always going to stay open. It's every day this fluid is building up. So, and it builds up as soon as you stop doing it. That's where the compression, this stuff, that's where it has a point because it can keep what you moved out.
Yeah, and that's what, and I know you're new to the cosmetic.
Yeah, I'm very
realm,
new.
but that's sort of my theory as well, in that the roller is something you can do yourself.
Yes.
And you should be getting the MLD massages after liposuction. Now, you had described a pretty intensive everyday type of thing,
Right.
and that's for somebody who, say, has some lower extremity
Yeah.
problem. And I know it's not your expertise, but I'm just going to ask anyway. So with liposuction of the abdomen and the flanks and the back, the total 360-degree lipo, what do you think would be a good treatment
Tens.
time?
Think of tens.
Okay.
So 10 deep breaths, 10 opening here, 10 opening this way. And then if you've opened that watershed, then just start sending it in strokes of 10. Do one side 10, do the other side 10, but just think of it in tens.
Okay.
Yeah.
And how frequently my question is how, directed towards like the manual lymphatic drainage
Yeah.
person doing that.
Right.
How frequently would you, like, let's say
So-
you had somebody with liposuction.
Yeah.
And it's different than you.
Yeah, no,
from what you're doing in the hospital. But how often would you want to see them?
So as PTs,
Just sort of curious
as
to
PTs,
see.
we always go over because we know they're not going to do that much. So I would probably say 5 times a day because you're recovering. You're not running off to work, are you? Are you?
No.
Yeah. So
Yeah.
you're recovering.
So
do
you
5
would do it
times a day.
5 times a day. Yeah, 5 so people do 3.
Yes.
Yeah.
Yeah.
Well, the same thing that I do with wound incision
Yeah.
care to get the best scar is I always tell people twice a day for 2 minutes, and I hope that they do once a day.
Yes. Oh, I've
For 2 minutes.
You actually told me twice a day for 2 to 3 minutes.
Yes.
Yes. Yeah.
Yeah.
2 to 3 minutes at each scar.
Yeah, I know. It's some people spend the
I'll
rest of
tell
their
you
life
what,
massaging scars,
but that has saved me, actually. I mean, I'm not much to look at, but I've had 12 surgeries on my face for skin cancers, and all that scar massage. I know
We
you can
talked
see
about
them.
it for a long time.
I know you can see them. Yeah.
Ever tell
They're
you're kidding.
they're everywhere. I've had big ones this way. I've had big ones this
Yeah.
way. I have several this way.
Every week
You
in the
can't
clinic was a
tell.
new,
You
new
cannot
bandage
tell.
on Cindy's face.
Yes.
That is crazy.
Yeah. I grew up in Wisconsin. If the sun came out, we were out there with baby foil. Baby oil and foil.
Oh, my goodness. So are there certain massages you could do on your face, or any like kind of just the touch? Was that helpful at all?
So to do the scar massage is completely opposite of MLD.
Let's talk about that because that's
Yeah.
interesting. Yeah.
So I did the MLD
Yeah.
every time I would have a surgery to get the swelling out. I didn't want the swelling because
Like in the
swelling
neck?
is I'd
Okay.
start at the neck. I would do some here.
Or by your ears,
And then
too?
I would,
Okay.
send everything over to those lymph nodes, send these down. But yeah, I was constantly doing that kind of thing
Mm-hmm.
in and out of my medicated haze. I would
That's
do some
crazy.
more.
Yeah.
But scar massage is totally different. I know this scar of mine, the surgeon that did it, she was very concerned about keeping the lip
Oh yeah.
bow.
Yeah. Okay.
And so she did. I think she did a fantastic job.
did,
Yeah.
But I had a spitting suture
Yeah.
right there. And it's funny because I know them so well that I'll call up and say, I have a spitting suture. And the doctor will say, she knows what she's talking about. Just bring her in and get it out of there. But anyway, so I did have a spitting one, and I can still feel that area. But scar massage for my lip, and pardon me, I think my hands are clean. I would get in there
Yeah.
Yeah.
and move it.
Yeah.
I mean, you're
Yeah.
not even sliding. You're digging.
Yeah.
So that's a good point. So the scar massage, what we advise people to do, and really the way you get your best scars, pressure massage and silicone.
Oh, silicone.
Yeah.
Yes.
And so but that's a deep massage. I think the mistake people that I've seen have always made with scar care is they just apply it.
Mm-hmm.
So they'll take the silicone, and you're thinking logically,
Yeah.
oh, I've got a scar. I bought this stuff at the pharmacy.
This is magic. It'll
this
do
is
something.
going to do something. You put it on top, and no,
it doesn't. Silicone is
it's
good.
a hard, firm massage. Of course, silicone's wonderful,
Yeah.
and but
not by itself.
You have to do the hard massage.
Yeah, and if
But the
you're
lymphatic is the opposite.
the exact opposite.
The opposite.
But with the scar massage, you're just focusing on that incision. So,
Right.
and if your incision is going this way, your scar massage is going this way. So that you're really, and I usually have my patients feel like around the incision, and there's always, you can right away after it's healed, you can feel the little lumps and bumps. You really can.
Yeah.
And so I make them touch it. Okay, I've got one right here. Do you feel that? And I'll put their finger on it, and I say, that's what you're working on. That's what you're trying to get rid of, is that hard bump. Yeah. And they're always there. Around a healing incision, around a healing scar, they're
healing
always
ridge.
there.
Yeah.
Yep. They're always there. And if you don't do that, a scar will have a tendency to want to adhere to the structures up underneath. And that's when you get those scars that have the big divot. I've seen them on, they're just tethered to what's up underneath. And that can be really, if you've gone through this, and then you allowed that scar to do that, you're going to have a big, like a second belly button with your,
So I want to circle back to, you mentioned, so we're talking about the self-care. You mentioned doing 5 times a day if you could. Hopefully you're hoping for 3. And then what about actually getting, what would you, like, let's say, Gabby had lipo and she's 2 weeks out and she's like, hey, I want to come to you for, do you make an individual assessment?
Probably.
Or,
Gabby's really healthy. I'd be like, yeah, you could probably do this on your own. I mean, if I did. You would
teach her.
Yeah, I would teach her the best way to do it and the most effective way, looking at where the incisions are and looking at where the swelling is, because the swelling might be in one little pocket instead of all over.
Yeah.
But yeah, I would look at all of that. Now, if I was moving a bruise, and this is a little anecdote because my husband plays baseball, and he had a circumferential sprain around his ankle, and went to the orthopedic. Yep, circumferential, and he comes home to me, and I did MLD on him probably 6 times a day, and when he went back in a week, the doctor was blown away. He's like, where's your bruising? You should be much more bruised. And he's like, Cindy moved it out of there. My ankle still hurts. Don't think it's, and it will still hurt.
Yeah.
But the bruise isn't there anymore. So, because you moved that trash.
Let's say Gabby's like, I don't want to do this myself.
There we go. There she is.
I've got 3 jobs and
Again, education.
And
if it's still Gabby, it's still education, because I'd be like, you did all this and you're not going to take care of yourself.
But if she wanted you to perform them, in addition to what she's doing on her own at home, how many treatments, what time course, what would that look like? Just kind of give me some frame.
Probably a couple weeks.
A couple weeks.
Yeah, a couple weeks, and maybe, I mean, after your boards have come off, maybe.
And what frequency would you do? Daily?
Yeah. Maybe, maybe 3 times a week. It wouldn't have to be that burdensome.
Yeah.
But yeah, maybe 3 times a week. Yeah.
And then sort of reassess.
Exactly.
See how she's doing on her own.
And make sure they're doing it on their own. Exactly.
And this was a really something, it was really fun working at the wound care center because, we're older now and in retrospect and we could talk about it. And we really taught each other.
Oh, yeah.
We really
absolutely.
learned from each
Absolutely.
other. And I think that's just so
I was
amazing.
Appalled when you came in and said, pack that wound with dry gauze. I'm like, they're supposed to be wet to dry. So I don't know what you mean.
Yeah.
No, I never do a wet to dry. I haven't done a wet to dry in forever.
Well, I mean, if the wound's really wet, I just never understood that.
You need some dry gauze.
But I think one of the things that I really learned from you was the whole concept you were talking about earlier, when that patient of yours had lost their thumb, and touching it and owning it. And Cindy's a huge proponent, and sometimes it's like a tough love, right? We would give patients like a tough love, like you got to stop that, like this is your hand, this is your
it's
whatever.
Not my hand. And if you're not going to do this for yourself, it's not going to get better.
You have to participate, and
Yes.
so, and I think that's why I like the roller. I tell people to use it from day one.
It gives them a tool.
Day one. So that they are developing that ownership. I think that is so important to healing and to recovering, to be able to do for yourself. People really want to know how many massages, how do I get them, and do that.
Yeah.
But I'm totally in your camp where let's say, for example, when we used to have patients that we would get home care for them.
Oh, yes.
Right?
Mm-hmm.
And so they would go and do their dressing changes or whatever the things were. But we were always, and Christina, maybe even tougher than anyone. She was always like, no, you got to do this yourself. Home care is not going to be there for you forever.
Right.
And nobody cares about you as much as you do, or your husband or your wife or whoever.
Yeah.
And so we would always try to get the families very involved and the patients very involved from day one. Yeah. And I still have that sort of philosophy.
Oh, sure.
Where patients, it's natural. Patients undergo liposuction of their abdomen. They don't want to touch it. It's completely the wrong thing to do.
Completely the wrong thing.
You have to right away touch. It helps with nerve regeneration.
Yes.
It helps mentally from a psychological point of view, accepting things and getting over things.
And finding those little lumps or pockets. If you're not touching, how do you know that you're not developing a seroma?
Yeah, or fibrosis.
Or fibrosis, exactly. You've got to touch to know what might not be right. And to your point about when you go see a professional, at the beginning, yes, to learn and everything. But gosh, if you find something that doesn't feel right to you, a couple weeks down the line, go back to them and say, is this something that I should be concerned about? Is this something that I can do something about? Because you wait for the year.
Yeah, it's too late.
It's too late. It's too late. That fibrosis has set in. You can move it a little bit. You can get it out of there, but it really is not going to be as good of an outcome if you don't start from the beginning.
Yes, absolutely. And as I was mentioned earlier, when there's not as much education out there, it gets filled with gaps. And I always call them Facebook groups. So people who I think are meaning to do well, and they're trying to help people, but they're not coming at it from the right educational point of view, maybe. Yeah. And you can get too much reliance on having these massages and think that that's where everything starts and stops.
Exactly. Then all of a sudden your therapist owns your leg, and that's not. Yeah. That's not.
And people will say to me, that have lumpiness, they'll be like, well, I did everything correctly. I did 10 massages, and I wore my faja, and I wore my boards, and wore my foams, and that's all good. But this whole concept of doing for yourself, and that's. I keep talking about it, but that's why I think the roller is just so amazing.
Right.
Because you're actually giving somebody a tool that they can use to perform some type of manual lymphatic drainage.
Right.
I'm not saying this is the be-all, the end-all, you don't need anything else. But as you mentioned, doing multiple techniques and multiple times during the day,
Right.
owning it,
Right.
doing it, and doing it from the very beginning is going to really pay off in the very end. And the other thing that I think is not mentioned or overlooked is some of the success. Like when you had Skip's ankle, right, and got the
Chip.
bruise. Chip, sorry.
Kip was our supervisor. That's
Chip.
right. Yeah.
When you, when you had that success,
Yes.
then that's also you feel good about it, right?
Right,
He feels
right.
good about it. Oh,
Yeah.
my wife's helping me.
Yeah.
Things are going.
And then the orthopedic is calling me going, what did you do?
Yeah, but it feels good.
Right,
So if you
exactly.
recognize something on yourself, if you find a lump, you find a bump, you find some fluid,
Right.
and you go at it and you attack it and you're carefully and you're vigilant, and you're doing your lymphatics
Right.
yourself, then there's an element of success and feeling of, wow, this is good.
Right,
I
exactly.
found this and I kind of treated it myself. This is awesome.
This is awesome.
And that will
Yeah.
help with
Exactly.
because in recovery,
Because then
they're
you'll want to show
also-
somebody, and look, you can't even see that. You can't even see that scar, can you?
Yeah, and it's
Yeah.
a success, and there's
Exactly.
times during recovery can be difficult. I mean, depression and is something real that happens to patients
Sure.
after having any type of surgery, and I see it
Right.
even in patients that have liposuction. They get really down, really
Yeah,
depressed.
because they think they're going to be perfect as soon as they come out.
Yeah.
And it's a healing process.
Right.
And yeah, so setting them up for that expectation of this is going to take some work on your end,
but then
but you'll get there.
you get there, but you participate, and
Yeah.
so you share in that success.
Exactly.
And that feels good.
Yes.
And you're not just like, oh, I'm going to go have this, and he's going to suck all the
Yeah.
fat out, and then
Yeah,
I'm
and
done.
then if it didn't turn out, it's his fault.
Yeah.
Well, no.
Yeah.
No,
So
if you-
I think
if-
that participation and
Right. You got to buy into
success
it.
is also really helpful from an emotional point of view.
One big point that I wanted to make, because we are moving the trash with this MLD. I don't know how you feel about water, but if you are doing this regularly, you gotta hydrate
Yeah.
heavily, because that trash is just sludge, and you've got to help it move out of your system. And if you're not peeing regularly, it's going to
Yeah.
stay in your system as junk.
Because that's how
So-
you're eliminating it.
Exactly.
Yeah.
Exactly.
What about lymphedema?
So that kind of is what we've been talking about. When you don't move that fluid, that's
just
the
that
result.
Okay.
Lymphedema, and truthfully, lymphedema, a lot of people in my line of work think of legs this big. It's not always that. It's any edema that pits. And by that I mean, when you've been out walking around so much and you have socks on, lower socks on, and you take the socks off and you see the line of the sock.
Yeah, of course.
That's lymphedema. It made a pit around with that sock where it constricted. So that pitting is lymphedema. The fluid up underneath there is lymphedema. And you go put your legs up and do a little MLD and it'll be fine.
Are you maybe referring to somebody that has like true disease of the lymphatic
That's
system?
that is what I was saying. So, but
Because when we're talking post-operatively,
yeah,
we're not talking about a disease of the lymphatic
We're
system.
not. We're
the
not.
lymphatic system was disturbed
it was.
and disrupted by the cannula moving 4,000 times
Exactly.
back and forth.
Exactly. So trauma creates lymphedema. So lymphedema isn't just this, you've got a giant leg. Lymphedema it comes from trauma. It comes from surgeries. It's all of that fluid, lymphatic fluid, that is causing edema, that's causing swelling. So it's not just the huge leg that is totally fibrotic. It's any kind of swelling that pits.
And we're, we're talking about swelling in a negative way, right? That it's interrupting things.
Yes.
But your body's natural response to injury is to swell.
Right.
And it does that because it's helpful.
Right.
And by accumulating that fluid and by expanding that lymphatic fluid, you're helping to create a system where you're removing those byproducts of the metabolism.
Right.
And you're getting, and that's really how you are healing.
Right.
So swelling is normal.
It's normal.
And it's expected, and it helps us heal. But
you got to get rid of it, too.
We're helping it.
Yes.
You are helping
it
the
move.
body get rid of it. Because
Yeah.
the body's job is to swell and then absorb all this trash and then pee it out.
Yeah.
But what we're talking about is stepping in to help the
that.
body.
Exactly.
And we really need to help the body because it's fighting gravity.
Right.
Because
exactly.
everything is trying to go one way up.
Right.
And so we're trying to assist that so that we're helping. And when you really are moving all of that trash, as you call it,
Yeah.
all the metabolic wastes and things, you're creating a healthier environment for the cells that are back there.
Right.
And you're also, by changing that gradient, you're helping the cells to eliminate.
Right.
Like if you've got all these, we used the analogy earlier with the cars. If you got all these cars that just have to get out,
Yeah.
like you help them by clearing out the highway and clearing out these streets and roads, so then those cells can like pump out more of the cars that they don't need. They're
Exactly.
like, we got to get these things
So
out.
we cleaned up this area, and now we got to get out of here. Exactly. And because I love your garment, that is also really helpful in clearing out that stuff, because especially if you're moving around, because again, that muscle pump is pushing against that hard wall on the outside. And so your lymphatics are going, oh, I got to move, especially if you're moving around.
Yeah.
If you're just laying around, it's not as effective. It can be effective, but moving around in compression is a really good way to move it.
Yeah, and that's again, a natural response to surgery is to not move.
Yeah.
And I encourage everyone, I tell everyone, people always want to know, what can I do? What can I not do? What can I do? I'm like, do whatever you can.
Yes.
Move.
Move.
Yeah.
Move your body.
Move. Yeah.
your body.
Get up, take short walks.
Yes.
We tell patients prevent blood clots, which is true.
Right.
But it's also very helpful from a swelling point of view.
Yes.
And if you're wearing the foams, you're having the foams work with
Right.
the little movement and
Yes.
then that outside compression.
Yeah, exactly.
So I think we touched on most of the topics here. I mean, for me, some of the big takeaways were touch therapy, and the patient needs to be just as involved in the overall process, from the change to healing all the way through. Is there anything else you would like future current patients to know who are interested in this process?
Yes. So flying and lymphedema aren't
Friends.
And
We have you have a lot of out-of-town patients,
Yeah.
so
Yeah,
this is
so-
very relevant.
So know what you need to do for yourself before you even embark on this, but then also know what you need to do for yourself before you get on that plane, like wear your compression.
Yes.
The atmosphere up in a plane is, there's a lot less pressure. Even though they pressurize the cabin, they don't
Right. Of course.
pressurize it to sea level. And so that hypobaric situation sets you up for more swelling. So do all of your exercises per protocol, and then absolutely wear your compression on a plane. You need to.
And what about having somebody at the other end lined up?
Yes. Have the MLD therapist lined up before you even
Yeah.
come down here.
Yeah.
Go meet them.
Yes.
Go tell them what you're having done, and then say, I need an appointment for X date so that you can help me through this recovery period.
So that's interesting. Meeting the therapist
Beforehand.
That's a great.
Sure.
I've never heard anyone talk
Yeah,
about that.
why
That's a
not?
great
Yeah.
idea. That makes a lot of
Yeah.
sense.
Because they're your caregiver too. At a
Right,
certain point.
exactly. So, and to be honest, there aren't a whole lot of us out there. So
Yeah, that's a big
that
problem.
project of finding the professional is gonna you don't want to save that for when you get home.
Right.
You want to know you have somebody in your pocket before you leave.
Yes, that's a super good point.
As well as, I'm sure, appointment availability as
Yes.
well. You need to have that scheduled
exactly.
out.
Yeah. So, I mean, you've been planning this surgery for a long time in your head.
Yeah.
Make the plan.
Make the plan.
Make the plan,
The
and,
whole
and
plan.
work the plan.
The whole plan. Don't
Yep.
do the post-care after the surgery.
You're right,
Have
exactly.
it set up. Have the plan to go.
Yep.
And then obviously get your OG roller. That'll help you
Yeah.
as well at ogrecovery.com.
Yeah, no, I'm so proud of that roller because I think it's providing patients with something that is a tool. Maybe it's because I worked with you for so many years and realized that
Own it.
that people have to do for themselves,
Yes,
and
yeah.
you're going to get the very best results if you do that.
Yeah, as
Yep.
well as your compression garments.
Yes, your
Well,
garments.
Cindy, thank you so
Thank
much.
you.
Thank
It
you.
was
Thank
awesome.
you.
Oh, it was awesome. It was
just
really
great
good to
talk
see you guys.
about all this. I love this.
Get your OG recovery products because better recovery means better results. And the more you know, the better you look. Dr. William, thank you. Cindy, thank you again. We'll see you on the next episode of Behind the Mask.
Thanks so much, Gabby. Thanks, Cindy. That was
Thank you.
great.
Behind
So wonderful.
the Mask, the podcast. Behind the Mask. With Dr. William, the OG genius. Behind the mask, mask, mask. The more you know, the better you do. Behind the Mask, the podcast.